So the next session will be on exercises to reduce fall risk in older people, what evidence says. So this session will be by Dr. Sumaiyah. Dr. Sumaiyah is a senior lecturer attached to Center for Healthy Aging and Wellness, HCARE, Physiotherapy Program, University Kebangsaan, Malaysia. Sumaiyah finished her 3-year postdoctoral fellowship in Aging and Age-Associated Disorder Research Group in the Faculty of Medicine and Center for Innovation in Medical Engineering, Faculty of Engineering, University of Malaya in 2020. She received a PhD in medicine in 2017. She has a bachelor's in biotechnology with Islamic studies and recently finished her Masters of Applied Statistics at University Malaya as well. Her research interests are falls, osteoarthritis, impairments in older adults, and biostatistics in health sciences. So without further ado, let me pass the floor to Dr. Sumaiyah.
Thanks, Kitara.
Welcome.
And can you hear me? Yeah. Okay. Hello, everyone, and Assalamualaikum. A very good afternoon for everyone. So I think I will share my slides now. For this next 20 minutes, I will be talking about exercise to reduce falls risk in older people. I will delivering this talk in Bahasa Malaysia and also English. Please don't be hesitate to ask any question if you don't understand. Okay. So just now, Prof. Tan already explained about the factors related to falls. So actually, there is also non-modifiable factors like age, gender, like female are more prone to fall than male, and then ethnicity, in which Indian are more likely to report falls, and also so all these are kind of unmodifiable risk factors. But then there are a lot of modifiable risk factors, which mean that fall is actually preventable. Okay, so today we would like to actually focus on my talk is focused on the balance, the gait and balance, the second main risk factors for fall, just now mentioned by Prof. Tan. Okay, and also the fear of falling. So does anyone know how much exercise does older people need? Anyone know? Can anyone answer in the chat box?
Twice a week. Nurul Nabila has said twice a week.
Correct, Nabila. It's actually at least twice a week. According to the NHS in the UK, they propose that in a week, at least 150 minutes for other people to do the moderate activities, or 75 minutes for vigorous activities. Example for moderate activities like aerobic exercise, while the vigorous like football, cycling on hills, and others. Okay, so how does actually exercise can reduce risk of falls? So firstly, exercise of course can strengthen our muscle, and then it will actually improve the balance, and psychologically it will reduce the feeling of fear of falling. So this is the most what we call the most evidence-based exercise, which is Tai Chi. This is kind of mind-body exercise. So usually Tai Chi involves not only movement, it is combined with the meditation, focused breathing. Okay, so most likely Tai Chi will improve your body alignment and posture. You will avoid slouching and rounding the shoulders. Okay? And a lot of studies have shown that Tai Chi is actually can relieve pain if you have osteoarthritis, knee pain, or any type of joint pain. You can actually try to relieve the pain by frequently do the Tai Chi. Okay, and also can improve mood. Okay, and also the mental health. So here where that Tai Chi can actually prevent you for being fear of falling. So that's why Tai Chi is one of the proposed or the most type of exercise that have been what we call disarankan lah for older people to do frequently to reduce their risk of fall. Okay. So next is aerobic. Okay. Can anyone suggest what type of exercise considered as aerobic? You can always chat write in the chat box. Okay. Selalu bila kita cakap pasal aerobic, kita ingat like dancing ikut music, right? Movement yang ikut music. It's not that only lah. It's actually a lot of other type of exercise we consider aerobic. Can anyone give me some example?
Judith and Lee has said Zumba.
Yeah, Zumba, and then actually like jogging, brisk walking. Brisk walking is also considered aerobic. Okay, and then swimming, cycling, and running. Okay, so that's the other kind of aerobic exercise instead of just a Zumba or like movement according to music. Okay, so there's a vast of a type of aerobic that can you use to do like weekly, twice weekly to actually reduce the risk of falling. Okay.
Mr.
So
Raymark
next,
has, oh sorry doctor.
yeah,
Mr. Raymark has said hiking, kickboxing.
hiking, kickboxing, okay, but the one is kind of more vigorous activity. It's also considered under aerobic, but then it's more like more vigorous, not that moderate lah. Okay, it's also a good example. Okay, next is yoga. Okay, so yoga is more or less like Tai Chi. It's a mind body exercise. It involves meditation. Okay, so if you are more interested in yoga, you can do yoga. If you are more interested in Tai Chi, you can do Tai Chi. Both of them actually more alike lah. Okay. And the last one is the Otago exercise, or actually this is kind of strengthening exercise. So if you would like to do kind of strengthening exercise, you can do Otago. Just now, Prof. Tan already mentioned in my faith study, we actually conduct Otago exercise to intervene the risk of fall. Okay. So what is the factors that hindered older people from exercise? Okay, so this is only a personal, what we call personal thoughts. Maybe you have your own thoughts. For me, I think the usual alasan excuse that they give is that makcik tak larat lah, makcik tak nak buat exercise. Makcik sakit kaki, makcik tak nak exercise, like that. Or when we do like exercise in because that the study is in they said they have a logistic problem. Okay, sometimes like tempat jauh, tak ada orang nak hantar. Okay, and some of them also give excuse like they memang tak minat exercise pun, memang tak suka exercise. Okay, and also no motivation lah to do exercise. Maybe they ada maybe depression or no, I don't know. Maybe they have their own problem that they don't want exercise. Okay. So what Otago exercise like the kelebihan of Otago exercise is actually it's very cheap. Yeah, we don't need peralatan canggih like treadmill, okay, bicycle, tak perlu. We don't need that to do Otago exercise, and it can be done at home. So that's why just now Nurhayat tanya pasal online Otago exercise. Yes, it can be done at your home, so it can be done online. Okay, no need to actually go outdoor. You can do indoor, and it's easy. Actually, you can follow the instruction from the physiotherapy straight away lah. Okay, even though you are alone at home. Okay, so this is what we call evidence-based. So my title is what evidence say. So this is one of the example from the study in 2010, in which a systematic review what we call this study is actually compile all the existing study on Otago and look at whether they have reduce the mortality and falls in older adults. Okay, so this total study involved around 1,200, 300 participants. Okay, so we can see that actually also Otago exercise improve their. Sorry, I heard it. So it's actually can reduce the risk of mortality and also fall. Okay, this one is for mortality. Okay, so what we did in so we also published the findings. Okay, so we look at the impact of Otago on their balance, postural balance, and fear of falling, and also the falls risk lah, in older people with knee OA and impact gait and balance. Okay. So this is me, okay, in year 2000, I think 2014, 2015. Okay, I'm measuring Mr. Tan, I think, on his postural balance in this false plate. So we can see whether he has swaying or he can actually control her balance if step on uneven surface. Okay, so there's actually foam. He step on foam, and then the machine will measure whether they have how much the swaying, the degree of swaying. You're also asking about like fear of falling. So the kind of the item that we ask is like whether they are confident in wearing dressing or pakai baju, whether they are confident tak rasa nak jatuh. Okay, and then when they are take bath, whether they also confident tak rasa nak jatuh. Okay, bangun dari kursi, getting up from a chair. Okay, naik and turun tangga. Okay, take something above of their head, whether they are confident to do that. Okay, and menaiki turun cerun. Okay, is a slope. Going up or down the slope, and also joining a social activity like religion, also family gathering or any other meetings from their society lah. So whether they are always feel like confident or sangat bimbang lah, meaning that they are very what you call that, fear of very concerned on falling while doing all these activities. Okay. So we can conclude that Otago can actually improve their postural balance, pengawalan posture, and also reduce their risk of fall from this study in University Malaya. Okay. So this is example of activities of exercise in the Otago exercise program. It's actually consists of 34 type of exercise in which participant needs to do it at least 3 times, 3 to 5 times each week. Okay, and the exercise include warm-up exercise, and also strengthening, and also balance exercise. Okay, so warm-up exercise is very easy, like head movement, something like that. And then the strengthening is the movement of the knee and heel toe standing and balance like stair walking, something like that. And usually in Otago exercise, we will ask the participant to actually wear the ankle weight to actually increase the intensity of the exercise. Okay. So this sum up my whole talk. Okay. So actually, Otago exercise is proven to reduce risk of fall and mortality, and it's actually easy and it's not costly. Okay, you just need to pay the physiotherapist for the time and also consultation.
Thank you so much, Dr. Maya, for the very informative session. So I would like to ask if anyone has any questions. Puan Sharifah has said, my mom has dementia. She doesn't want to exercise or do stretches, but as suggested, but Puan Sharifah has learned not to suggest it, but just do the movement and let her follow them. Visual motivation on a daily basis. Is Otago relevant for older adults on wheelchair and to address fear for falling among those with dementia?
Thanks, Puan Sharifah, for the question. So I think this is very important question because in UKM ourselves also we have study ongoing to actually develop exercise for demented older people with dementia. Okay, so I think what Puan Sharifah did to actually show a movement and then her mom follow is very good approach lah. Okay, I think Otago exercise is still relevant even though the study is still ongoing. But I think we can actually do Otago exercise on wheelchair because we have physiotherapists who can actually prescribe the Otago exercise based on the condition, based on the patient condition. Okay, so I think I hope I answered your question, Puan Sharifah. Okay, I think the Otago is relevant because it's based on the prescription from the physiotherapist, and we have the physiotherapist in Air for Help.
She said she will reach out to Act for Help. Please do. We are more than happy to help you with your queries. Okay, anyone else has any other questions or if anything you would like to share with us? So if we have no questions, don't worry, at the end of this session, you can even drop us an email if you have queries. We will direct them to our speaker. Okay, moving on to our next session is by Dr. Nina on how is your memory.